It's midnight at the Carbondale Police Department. A teenager is crying. She's frightened and angry. A few hours earlier, she was a runaway. Now she's at the police station and her parents sit in the next room waiting to take her home. Everyone is upset. A Southern Illinois Regional Social Services counselor arrives and brings the family together, mediating whatever problem caused the crisis, making it possible for the girl and her parents to go home together. 3 days later, the family visits a counselor at SERS and begins to rebuild their relationships. Imagine a 32-year-old man addicted to drugs, whose life is on the verge of falling apart and there's no hope unless he gets help. He turns to SERS. A grandmother returns home after a 3-week hospitalization for the treatment of depression. A SERS counselor helps her organize her medication and goes with her to the grocery store to buy food. Each week, a case manager stops by to see how she's doing. A 12-year-old girl finds friendship and a positive adult role model through Big Brothers Big Sisters. And middle school kids learn about decision-making and teamwork. This is the work of Southern Illinois Regional Social Services, or SERS. We're not for profit, providing mental health, substance abuse, and youth and family services for the people of Jackson, Perry, and surrounding counties. This is our story. We think you may be surprised to learn how we help people of all ages build better lives. Even though we cannot possibly tell you everything in the next half hour, we are confident this program will give you a good idea of the work we do and why it is important you get to know us, even though you may never need us. To begin, let's talk about stigmas. We all know people experience mental health and substance abuse challenges. Take a look at these names and faces. All of them have experienced what I'm talking about. Yet despite their challenges, they continue to live productive lives. These are the faces of recovery and hope, and that's what we're all about. That's the essence of the message we deliver every year when we take to the streets and walk the blues away. You may have seen us, a crowd of people wearing the same t-shirt, carrying signs, smiling and waving as we parade down the sidewalks of Carbondale. The event is one of several we hold every year to raise awareness and make friends. These are the people behind SERS. These are the people who provide a broad range of service to adults, children, and families throughout the Jackson and Perry County region of Southern Illinois. These are the actual builders behind our slogan, Building Better Lives.
SERS is an extraordinary agency. It is a welcoming place. It is a place full of people who are really committed to helping others to achieve their goals.
If a community said, look, we just really don't have enough services for kids right now, we really need you guys to step up to the plate and, to do this for us, then we start looking for ways to go out and find the money that will actually help fund that service so that it can get done.
They're so professional and they're just willing to help in every case. And it's been a pleasure working with them over many years in support of children in Southern Illinois and families.
They make our job much easier. They make the lives of the students a lot better. So they are just a great resource to have.
Well, that's a part of what we're all about, is helping each other. And I believe in helping my brothers and sisters, so to speak, because we need help sometimes ourselves.
Some staff are available around the clock, responding to emergencies at hospitals and police stations. Others work just about everywhere in the community, helping people of all ages resolve problems. Every year we provide more than 100,000 hours of service to 3,000 people. If you take a calculator and divide 100,000 by the total number of hours in a year, you'll see we provided more than 11 years worth of service in a calendar year. Imagine all the people we've helped over the years, literally tens of thousands, and most are people who do not have the resources to get help any other way. Our counselors respond to mental health emergencies and work side by side with emergency room doctors to help treat those in need.
SIRS is an integral part of how we treat psychiatric patients in this emergency room. They're just key to a lot that we do on a daily basis. Very important, very helpful. Without them, our job would be much more difficult.
In the ER, we see a wide range of people. We see people that come in very depressed, very sad, maybe expressing suicidal ideation, to people that have been off their medicine or having their first initial psychiatric break.
The SIRS crisis team provides evaluations and crisis intervention 24 hours a day. Just as the emergency room treats medical emergencies concerned primarily with the patient's physical needs, the crisis team handles the behavioral emergencies.
We had a patient that came in who was on the Amtrak train and became more despondent and actually started demonstrating some bizarre behavior, aggressive behavior on the train. Was coming through town. They stopped at the station, called the ambulance, and had the ambulance bring the patient to our emergency room. It would take a huge amount of time for us in the emergency room without SIRS involvement to try to figure out what kind of previous psychiatric care they had had, what kind of outpatient care they had. But in this case, the SIRS counselor was able to come in, determining what medicines they were on, what previous treatment they had had, where they had been admitted before, and then actually arranging good transport of that patient back to their hometown, getting them back on their medicine, getting them back in with their psychiatrist for further counseling. It's a huge savings of time and work for us, and without them available to do that, would have made our job tremendously more difficult.
SIRS Crisis Intervention Services help area law enforcement and may include mental health evaluations and occasional on-the-scene assistance.
Our only other option might be to take a person to jail, and maybe that's not the place that's best for them at that time. So by being able to call in SIRS and some counselors, then we can figure out some different options maybe for them.
For children involved in crisis situations, SIRS provides youth crisis counseling. Children with mental health emergencies are most often seen at hospital emergency rooms or at school. Runaway children are most often seen at police stations. In the case of a runaway, the scene may involve volatile emotions between the parent and their child. The parents are angry, frustrated, and hurt. The child feels he or she is in a hopeless situation. Both sides are scared, and in the middle of this tornado of human emotion, you'll find the SIRS counselor.
What we would like to see is that the family reunites and the parents and the child is able to talk again, and they're able to communicate, and they're able to, move past, what that current situation was.
But not everyone enters our services because there's an emergency. Sometimes people want help and just pick up the phone.
If people are afraid to come in, we can talk to them on the phone and help them think through what they might want or need. If we're not the place they want to come, we'll help them think about where they might want to go.
Often the most effective treatment is a combination of medicine, counseling, and support. Sometimes it takes a while for treatment to work.
So it's very rewarding to see these people who have so many problems functioning after a while with help of medication. And also counseling is a very important part of this treatment, not just the medication.
Sometimes people with serious mental health challenges need help for a while getting by day by day. And SIRS provides the support they need.
You just never know what's going to happen.
Monette Logue calls herself a frontline warrior in the treatment and recovery of those with mental illness.
After working with these people for a few years, you kind of you know their symptoms.
She's a case manager in the Community Recovery Services Program. Her job is to provide assistance to those with severe mental illness. Today's schedule includes a visit with one of her clients, Christy, who has struggled with bipolar disorder throughout her life.
The focus of our program is their recovery. Recovery can mean almost anything to an individual, but essentially we want to improve the quality of life of everybody that we're serving the best we can.
We provide hope and dignity to people who would not have that opportunity.
How are you?
We help them to stay out of the hospital. Our services also prevent homelessness, which, although we're in a rural area, we do feel the impact of homelessness in this area.
They truly do care at CSRS, which is important to me. And this is the first place that I've not been talked to like a consumer. I've been talked to like a person. You know, the doctor didn't just tell me what he's going to do. We discuss it. And, you know, I don't like being treated like I don't know what I'm doing just because I have a mental illness, because that has no effect on my intelligence whatsoever. I know I am disabled at this point and that I do need help in economical terms because I can't really keep a job at the moment. But I really do one day want that to change.
All of our guys have normal expectations, but because of the symptoms of the disease, they're not able to pursue those as effectively as they might.
All right, she's doing very well, making progress towards treatment, recovery as she likes to call it. She knows if she has a problem, she can come to me, and if I'm not available, she can go to CI for support, which is our community integration program. The day program, she can go there and talk to the staff there.
Community integration gives those who are recovering from severe mental illness a place to go and a way to keep in touch with counselors and case managers.
Whether it's daily living things or social skills, to be a full-fledged member of the community. And that's, I think, our biggest role.
It's got me up doing things instead of sitting home and letting myself deteriorate. I'm the main person behind the staff, working the snack bar, and then people call me and stuff if they need talk. So sometimes I feel like I'm going so fast, my head's a-spinning. Figure 4 or 5 years ago, I wouldn't have done none of that.
A lot of these people like you and I may have somebody we can go to. These folks don't have a lot of families. They don't have significant others. They don't have major relationships in their lives. We are it for a lot of our consumers.
I'm just amazed at the courage and the determination that I see here. You know, there's times that, you know, maybe when I'm having a bad day and I come to work here and I hear about some of the things that our guys are facing and have beat back and come back from, you know, that motivates me.
According to the National Institute of Mental Health, 1 in 4 Americans over the age of 18 will suffer from a diagnosable mental disorder in a given year. 1 in 4, or 57 million people. Mental disorders are the leading cause of disability in the United States. And mental illness affects children, too.
In fact, they can have almost all of the same diagnoses or mental health problems that adults can have. Sometimes the symptoms are just a little bit different or present themselves in different ways. For example, in children or adolescents, depression might often take the form of irritability or temper tantrums, where someone might think that that's acting out or a behavior problem, or more often the source might be depression or some sort of emotional difficulty.